Ontario's COVID-19 restrictions were recently relaxed, although Omicron cases remain high across the province. For a look at the picture in our area, we're joined now by Dr. Janet DeMille. She's a medical officer of health for the Thunder Bay district, and she's joining me live from Thunder Bay. Good morning.
Good morning, Sean.
Now, if you could give us a lay of the land, how would you say things are looking in the district at this point?
We're navigating, this very significant Omicron surge that we have here in Thunder Bay in the district. I think we saw this very rapid increase from the end of December into the first couple of weeks in January in particular. It moved, the numbers went up very quickly. And since that time, it's sort of been a little bit up and down. On a number of the indicators, and it seemed really overall, because it seems to sort of had plateaued a little bit. So we did see some decline from a peak that probably occurred around the end of the second week, and then a little bit of a decline. Since that but the numbers are still remaining a little bit high. And not clearly going down in a very consistent way. So, I guess it's good that it's not still going up, because it definitely is not sort of going up, but the numbers are still sort of indicating we still have a lot of spread of Omicron in our area.
So then would it be fair to classify the situation in our district as it's reached its peak? Are we at that peak yet, do you think?
Yeah, you know what? Sometimes it's easier to see exactly what happened when you look retrospectively down the road. But I would say, the peak was probably the end of that second week of January. And then it has come down a bit since then, but it has stopped declining. So we did reach a peak and declined, but we're sort of at this plateau with not a consistent decline since then. And and it's still fairly high overall compared to our peak, I would say.
And I guess with that being said, people in a hospital, those numbers are still relatively high. What do you want the citizens of Northwestern Ontario, or the citizens of Thunder Bay, to understand about that?
Well, it is uncomfortable seeing what's happening in hospital, and these are the numbers we report are all hospitals across the region, and it's we're seeing people being admitted, and this is a virus that does cause significant illness, requiring people to be hospitalized, and there are people in the ICU. And we've had even, some deaths related to that. So, this remains a serious illness. And, the pressure on the healthcare system is one of the big concerns about as we, navigate this wave, the number of, what can the acute care system be able to manage? And it is really not just about, having to use resources to manage, individuals who do have COVID and who need that hospital support, but it is also the impact that it can have on other healthcare services. So that's, certainly something that we're seeing. Hospitalization is also what's called a lagging indicator. So it often peaks sort of after community cases peak. And so, what we saw is a very substantial rise in hospitalization numbers. And I'm not sure, the number right now remains kind of high. So I'm hoping that this is the peak for them as well, and we'll see that decline. But it would certainly help to have lower numbers in the community to help with that.
And last week, the Ontario government relaxed restrictions that were in place. Do you feel comfortable with reopening at this time?
You know what? It's always a balancing act. Any restrictions being placed, and when they're being removed, and it's always a balancing act. And again, there's so many factors that drive case numbers up, and then and factors that can reduce case numbers. That it's hard to predict exactly what will happen. I think, though, at the same time, these are tough times, right? And we have to balance it with being able to live our lives and do the things that we like, And, I just heard your news story about isolation of long-term care home residents, right? Need to find the right balance because it does, putting impositions on people or businesses have consequences too. So it's finding that right balance. I think what I value and what I appreciate is all the measures that are put in place in all these places. So the school reopening, lots of measures within the schools to reduce spread in those areas. When we see restaurants or gyms reopening at limited capacity, but the measures that they have and will help reduce the spread in those areas. So, we have learned a lot in the last 2 years of managing this, and I think we really all have to take ownership of doing the right thing so that we can have businesses and places open, that we are able to use those places. But take those precautions because that will really help us still being able to control what's happening in our community without seeing a rise in numbers. So I just, really want to remind people that everybody has a role. And follow the rules, when you wearing the mask. Stay home if you have any symptoms because there's a lot of people who have Omicron. They're not necessarily eligible for testing, but they, many people can just handle them, manage that at home, recover, and then they can return to their regular, activities. So really just encouraging everybody to follow all of those public health measures, and we will be able to reopen, whether the changes that were made on Monday, but even the ones coming down in February, we will be able to do that successfully and not let COVID-19 get out of hand in our area.
Now, our children have returned to school. I think we're a couple weeks into that process itself. Have you seen any impact of that yet?
So, obviously with all the changes that were made in the school reporting, we have sort of less knowledge about what's happening really at the school level. We do sort of follow some absenteeism. We're still very much in touch with the schools and supporting them in the work that we do. We know that some schools, we know that there's sometimes social media conversation or the Facebook pages that sort of report that perhaps people, were in school and they had COVID, for example. But there's a lot of measures again in place in those settings to help reduce the spread, and so that will help. I did wonder, how much when I say we have plateaued in our numbers, I did wonder how much that could be related to the reopening of schools, if that sort of caused some increase in cases at a time that we might have seen a decrease had the schools remained closed. So, but it's hard to know that for sure, and we're not going up right now. So I think the school reopening to in-person learning has been, I would say successful overall at this time. But I think again, it's with the further reopening, I think we'll have to watch all of this very carefully.
And walk-in vaccine appointments were recently just expanded.
Yep.
If people still need a shot, can you remind our listeners what they should know?
Yeah. So one of the things that I'm sure has really contributed to the case numbers and the fact that they're not higher with a virus like Omicron spreading, I think we have a high level of immunization with those first and second doses in our communities, and we have a rising level of booster doses. So I really want to thank people who have come forward because no doubt that has made a difference. And everybody, our high level of immunity, like that vaccine protection. The vaccine's not perfect against Omicron, and people can still get infected even if they have 2 doses of the vaccine. But it is making a difference compared to what we would have seen had this happened last year. What I would encourage people, and certainly if you're in Thunder Bay, anybody who's eligible for a vaccine can walk in. We also have still appointments available if people prefer an appointment, and we're going to keep those appointments at the time that they were booked, right? But encouraging people, if you haven't had your booster dose, 18 plus individuals over 18 are eligible for that third dose or booster dose. We're currently around about 57% across the health unit area have received their booster dose. So we know that there are still people out there. We're also very much encouraging 5 to 11. So that was the last group to be eligible for vaccination. We had a lot of people bring their kids in for that first dose back in December. They're now eligible for a second dose because it's been 8 weeks, and so certainly encouraging those for a second dose, but also encouraging, that we still see people bringing their kids in for that first dose. And with schools being reopened, I would certainly recommend that. And then really, people that are more vulnerable, age-related, so the older you are, the more vulnerable you are, regardless of your vaccination status. If you have underlying health problems, even a mild infection with COVID can kind of trigger those to get worse, whether it's a heart problem or lung problems. And the other group I just want to encourage is anybody who is immunocompromised. So somebody who might be on some sort of treatment for an underlying medical chronic condition that they have. They can be very stable on that, but it can be an immunocompromising medication. They're more vulnerable if they have COVID. So, and those individuals, by the way, are eligible for their third dose, but also a fourth dose if it's been a number of days since their third dose. So certainly encouraging those individuals to come in. But here in Thunder Bay, we've really opened up our clinic, which everybody knows at the CLE Coliseum, for those walk-ins, and we run at least 5 or 6 days a week, as well as the clinics in the district that we're also running. Just pay attention to our social media. We're opening really many of those to walk-ins as well, and people can just follow our social media to get more details on that.
Dr. DeMille, thank you so much for joining us.
Thank you again, Sean, for the opportunity.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District.